Okay, hi, this is Jess Given from GDG Healthcare Architects, here to explain and elaborate a little bit on what the different NPC categories are for hospitals. And OSHPD, or the Healthcare Access and Information, is a department that has jurisdiction over all the healthcare facilities in California. And they've designated a priority starting from NPC 1 to NPC 5, so that they know that these are expensive undertakings and that hospitals need to plan accordingly. So they started after the Northridge earthquake in '93, and they started to identify the date when all of these performance categories needed to be addressed and completed in compliance. And that date is 2030, which is just 5 years from now. So NPC 1, breaking it down into these the lowest category to the highest, NPC 1 is simply an identifier that says your building is not compliant in any form. None of the components inside the building, none of your systems inside your building would still be operational during an 8.0 or after an 8.0 earthquake. NPC 2, it's the just the essential critical parts of the hospital that allow the occupants to be able to evacuate. It's also a very low category in the priority, but it does allow, at least at bare minimum, the occupants of the building to evacuate. So your oxygen systems, your fire alarm systems, your egress, all your lighting, all of that needs to be in place, and that's primarily going to be in your corridors, so that allows the staff, the patients, and the public who are in that building to evacuate safely. NPC 3 takes it up a notch and says, okay, we have ORs, we have radiology, we have pharmacies, we have sterile processing labs and clinical labs. All of these are critical to the staff and the doctors in the hospital to be able to provide the services they need. So NPC 3 really addresses the critical care areas inside your hospital. So all those, and what I mean by addressed is they need to be anchored to such a point where literally if you turn it upside down, it's not going to go anywhere. It's going to be completely functional and you can shake it and it's going to still be operational. NPC 4 now is your entire building. So we've gone through NPC 2, NPC 3, now you're at the entire building. So now you're talking about really all the components in the building, everything is secure. Your medical dispensers and your nurse stations, your water softening systems in the central plant, the CT scans and your large imaging equipment. So all of that has been anchored, and none of that is going to cause problems during an 8.0 earthquake. And NPC 5 is the last and highest category. All of these have to be construction completed by 2030. So NPC 5 is the premise behind NPC 5 is that if an 8.0 event does occur, and the expectation is that many of the buildings surrounding that hospital are going to be unusable, you're not going to be able to enter them. They're going to be probably damaged to the point where they're unsafe to occupy. And your sewer lines, your gas lines, all your utilities, your power lines, all of that is expected to be broken. When the earth shifts, all those utilities are going to be broken. So NPC 5 says, your hospitals, most hospitals are on a campus setting, and that campus, that whole entire perimeter of that campus for all the essential buildings that are serving that community, that it has enough water to supply the use of anything from a toilet to a hand washing fixture to your water softening system. It has enough waste so that if you're able to, a patient's in a room and they need to flush a toilet, they're able to flush a toilet and it's actually going to go somewhere. Assuming that your waste lines are all broken, so where would that go? So we have to come up with temporary containment devices, large inflatable bags or secondary holding water tanks that can provide enough water to the facility. So that's the last category of NPC 5. So this is the deadline. All the hospitals in California are trying desperately to meet this deadline by 2030.